Hi, I'm Dr. Jessica Eccles. I'm an associate professor, a reader in brain body medicine at Brighton in Sussex Medical School. I'm also a consultant psychiatrist in a neurodevelopmental service.
Hi, I'm Lisa Quat. I am a principal research fellow, associate professor at the Department of Clinical Neuroscience at the Brighton and Sussex Medical School.
Lisa, what is this study about?
So, this study explored the connection between three things: bipolar affective disorder, which is a mental health condition involving episodes of mania and depression, neurodivergence, which describes neurodevelopmental differences like autism and ADHD, and joint hypermobility. This is when joints move beyond the normal range, which is linked to differences in the connective tissue in the body. And we looked at these three things because bipolar disorder and neurodivergence can actually look quite similar. In both, we can see differences in attention, energy levels, and so on. And from previous research, we also know that joint hypermobility is actually connected to neurodivergence, and especially that having bendy joints might play a role in the emotion regulation differences we see in neurodivergent people. So in this project, we wanted to tie all this together and look if people who have a diagnosis of bipolar disorder are more likely to meet screening criteria for autism and ADHD, and if joint hypermobility might have something to do with this. So what did you find?
We found in a group of 50 patients with a bipolar disorder diagnosis and 50 patients without a bipolar disorder diagnosis that joint hypermobility, so the presence of flexible joints, predicted whether you had bipolar disorder or not, and that the relationship between hypermobility and bipolar disorder, so low mood and high mood, was in fact explained and influenced by the presence of neurodivergent characteristics. Why is this study important?
So this research shows two very important things. First, it shows that when we are looking for treatment and support options for people with a diagnosis of bipolar affective disorder, we need to consider that they are quite likely to also be neurodivergent. Secondly, our research challenges the idea that body and mind are separate and that mental health conditions like bipolar disorder are not influenced by our bodies. So this means that we need a more integrated approach to how we diagnose people and how we support people with bipolar disorder. Why is this useful for the future?
I think this study is really going to pave the way for the future in two or three different ways. The first is in trying to make sure that when people are assessing patients with mental health problems like low or high mood, that they look for hypermobility and they look for neurodivergence. So that's the first important thing. The second important thing is I think that this this consideration of the brain body interconnectedness and the relationship with neurodivergence and hypermobility may influence how we reconceptualize and think about diagnostic categories in mental and physical health in the future. And by this research basically paves the way for people to begin to challenge the assumption that what we've always thought was right was right. It also opens up the idea of looking at other psychiatric populations. So the idea that ADHD and autism are somehow separate from psychiatric conditions like psychosis or bipolar disorder or eating disorder. And this is work that our group here at Brighton and Sussex Medical School are actively researching right now. So please follow the link below to find out more.